This is a nurse-led project. The students build the flu clinic from the ground up. They deliver the vaccines and they manage the clinic as part of their public health nursing project for the semester.
So getting to be a part of the next group of students to carry this out has been a great opportunity. Within this clinical, each student sort of assumes a professional role where we take the lead with our faculty as advisors. So there's two sides, there's a marketing side and a logistics side. And at the end of the day, we both are coming together to meet the needs of our TCU community. There's a team lead who organizes the agenda for the day and is the main go-to for information. There's a secretary that makes sure they take notes to keep in the binder for future groups of clinical students so they know what we have been doing and keeping on track. There's a safety manager and a supply manager. They're crucial to the success of the day clinic and our pop-up clinics when making sure we have all the supplies we need, working alongside the TCU Health Center to orchestrate and gather everything we need. And the safety manager helps educate us on what to do if there's needle sticks and the procedure for if someone faints. And these are all crucial pieces that you need to have a successful clinic.
The Flu Clinic started in 2009 with a collaboration between myself and Steve Kintig from the rec department. Steve has since passed away, but his legacy remains in the fact that we continue with this wonderful project that we have done. We have grown from a small partnership between the two of us to now we have over 10 community-based partners and TCU campus partners. The Flu Clinic offers wonderful opportunities for students to collaborate with Harris College. We have a lot of students that volunteer at the clinic. They may not be skilled in giving the vaccine, but they can certainly help monitor what's going on at the clinic, help guide our guests into and out of the clinic. We open interviews for StratCom students. Oftentimes we have students come and interview with us just to find out what our students are doing. We work with the Fort Worth Fire Department. Our newest partner is HR. And we work with the rec center, of course. We also open the clinic early to the ROTC students so that they can make it to their early morning PT classes and not miss getting the vaccine. Likewise, we hold special bubble clinics where we kind of contain who is being exposed. We work with COSD students, their graduate students, to make sure they're not coming to the mass clinic to reduce their exposures. We go to them and make sure that they're vaccinated. We also work with the Star Academy and groundskeepers and housekeepers because they're on a different shift than the mass clinic, so we meet their needs as we can by coming to them before they leave shift or go on to shift. It's an academic experience for me, and it's a wonderful learning experience for the students, and the community gets the benefit of the vaccines. The greatest impact that the Flu Clinic has had over the years is that we were ready during the time of COVID. They knew exactly what to do to set up a mass clinic. We basically just exchanged out the flu vaccine for the COVID vaccine and we moved forward, and it really did anchor us during the time of COVID. One of the goals of the Flu Clinic is to grow it through the professional colleges. As Harris College grows and the medical school grows, the opportunity for medical students and nursing students to learn from and with each other is also something that we aspire to have happen. They sent student leadership and one of their professors came to observe how we deliver the vaccines in mass in our community. 2 DMP students build and reframe the Flu Clinic as a toolkit for other universities. This is an example of the quality of nurses that TCU is producing every year. The nursing students have perfected the Flu Clinic to the point where it is described as a well-oiled machine. And we just encourage other professional schools to join us in this effort to vaccinate our communities.
Participating in the Flu Clinic is allowing me to practice the leadership skills I have learned throughout my time in the TCU nursing program. Additionally, it fosters team building between me and my classmates as we are taking on different roles, but ultimately coming together for this public health initiative to educate, protect, and give free flu vaccines to the TCU community.